Welcome to Concept in Medicine. In today's tutorial, we are going to be looking at drug-resistant TB. Let's begin by looking at the two main drug-resistant TB. Then after that, we would comment on the others. So the first one is what we term as multi-drug-resistant TB. And when we say multi-drug-resistant TB, it means that the isolate, that's the mycobacterium isolate, is resistant to at least rifampicin and isoniazid, and those two medications, they are the most sensitive anti-tuberculosis medication. And if you are having multi-drug resistant tuberculosis, how should the treatment go? So in that case, 5 drugs will be used for intensive phase. That will take a duration of 5 to 7 months, and the continuation phase should be extended for a duration such that the total duration of treatment is 15 to 24 months. The drugs which are considered in this scenario in no order of merit, we can talk about the fluoroquinolones, we can think of aminoglycoside. The fluoroquinolones, we are thinking examples, we are thinking of levofloxacin, moxifloxacin, ofloxacin. Aminoglycoside example, we are thinking of the amikacin or the streptomycin. You can also think of ethambutol, which is part of the first line, the pyrazinamide, ethionamide, linezolide, cycloserine, delamanid, para-aminosalicylic acid. So these are the drugs that you should consider in using for the treatment of the multi-drug resistant TB. The next drug resistant TB, we call it extensively drug resistant TB. And for the extensively drug resistant TB, it carries a high mortality rate and it has limited treatment options. And when we say extensively drug resistant TB, what do we mean by that? It means that the isolate, which is the mycobacterium tuberculosis, is resistant to at least 2 of the first line drug medications, specifically isoniazid and rifampicin, at least 1 injectable, which could be kanamycin, amikacin, or capreomycin, and 1 fluoroquinolone. Then we can say that is an extensively drug resistant TB. And for extensively drug resistant TB, the treatment should be continued for at least 24 months, that is 2 years, using the second line medications. Example, we are thinking of ciprofloxacin. An example of the drug there, we are thinking of moxifloxacin, which is highly effective. You can start with levofloxacin if the strain is resistant to that. Then we move to ofloxacin. If it's resistant to ofloxacin too, you can go to moxifloxacin or to any of the fluoroquinolones that the drug is resistant to. You will switch to a drug in the fluoroquinolone class to which the drug is not resistant. Also, you can think of an injectable to which the strain is not resistant or has never been used before. The other types of drug-resistant TB, we can talk about the monodrag-resistant TB, simply put, drug-resistant TB. And for the drug-resistant TB, or what we call monodrag-resistant TB, the isolate is resistant to only 1 of the first-line medication. It could be rifampicin or it could be isoniazid. And for that, the drug to which the strain is resistant should be replaced by other drugs, as the second line drugs, and the first line drugs continued. And also, if we are looking at that, then we can say the multi-drug resistant TB and extensively drug resistant TB, they belong to the poly-resistant TB as a group. Then finally, based on the strain and how it is acquired, we can have another 2 classifications of drug-resistant TB. That will be a primary drug-resistant TB and a secondary drug-resistant TB. For the primary drug-resistant TB, it means that the patient is infected with an isolate which is already drug-resistant. The patient is infected with an already drug-resistant strain of Mycobacterium tuberculosis. And for the secondary drug-resistant TB, we will say that for that, the patient developed the drug resistance during the course of treatment, meaning that strain develop the resistance to the drugs during the course of treatment. I believe we've learned something new today. Kindly make sure to subscribe to my channel, share, like, and comment the next concept you would like to see on my channel. My name is Dr. Del, and this is Concept in Medicine. Bye-bye.